Hi everyone, welcome to another video. Last time I talked about the education that's required to become an injector and what to look for to find a good injector. And today I want to talk about using facial ultrasound to increase the safety of facial injections. This is a new up-and-coming growing field in aesthetics. It's very exciting, and more people are starting to use it. If you go to someone who does use facial ultrasound prior to injection, then you know you're in excellent hands of someone who is very safety conscious. If you enjoy my videos, please drop a like and subscribe to my channel. And let's get started with facial ultrasound. As you may or may not know, injecting fillers into the face comes with its own set of potential risks, the worst of which include skin death or necrosis, which, if not treated appropriately, could lead to the patient requiring a skin graft in the worst case scenario. And other possible adverse events include potential stroke and blindness, and if not treated in a timely fashion and appropriately to reperfuse the tissue and open up the occlusion, these can have devastating long-term effects. Now, these risks are significantly reduced if you go to someone who has experience and who understands the anatomy of the face. They know where to expect blood vessels, so they're more wary and careful when injecting in those areas. So whenever we do a piriform injection or anything to bring the nose back out to prevent it from falling down and into the hole for the nose and the skull, which enlarges as we age and makes our nose kind of fall down and point down, we need to make sure there isn't a blood vessel there. And whenever we do tear troughs or anything here, we really have to make sure that this artery isn't, doesn't have a variant, an anatomic variant, where it's more lateral than where it should be. And while there is a normal trajectory and course for all of anatomy, there's also a slew of normal variants. Everybody's a little bit different. So ultrasound allows us to actually see where we are and what's underneath the skin, knowing exactly where we want to go and where we don't want to go. This is my ultrasound transducer. It is just like the ultrasound transducers that are used for obstetrics, or if you've ever had an abdominal or an MSK ultrasound, it's exactly the same concept. Sound waves are sent out through this little plate, and as the sound waves hit the tissues, they reflect and send the echoes back. This picks up the echoes and is able to transform the echoes into images, which we can then interpret. It's very cool technology. The only difference with facial ultrasound is the transducer is designed for high resolution images and not a very big depth. So this wouldn't be great, for instance, to image the liver. And this is 20 megahertz, which is one of the high frequency type ultrasounds. So this allows us to have gray and white images that allow us to see tissues, but also it shows us blood flow with color, so we can see exactly where those vessels are and map them out before we ever put a needle underneath the skin. So why would we use this? Well, if we apply it to danger zones, and some specific danger zones include the temples, which are quite deep, and they have arteries running in various layers of the skin and underneath the skin all the way down to the bone. Another danger zone is in this area of the nose, because we have our facial artery coming up around the jaw by the corner of the mouth, traveling beside the nose and up towards the eye. And every one of us in anatomy has variation that is expected. Sometimes this artery might be farther out, sometimes it might be farther in, sometimes it's very deep on the bone, sometimes it's superficial underneath the skin. And we don't know that unless we see it. So with this, we can see it, and it keeps us safe. I want to show you a few images just to show you what it would look like. When we want to image the vascularity of the lips, for example, we need to put a lot of gel on here so that we have the medium for those sound waves to travel through and hit the tissues and reflect back, and we can image. And I'll show you an image that's like this, where you see the profile of the lip. And also over here, I'll show you how this artery courses along the tissues and up beside the nose, just so you have an idea of what these pictures look like, just for fun. More and more people are getting excited about this, and it is very cool, and it really does increase safety by quite a lot. If you have any comments or questions, be sure to leave them down below, and I will get back to you as soon as I can. And otherwise, I will see you guys in the next video.